Hello, my name is Jorge Rodriguez and I talk about the central pontine myelinolysis. The central pontine myelinolysis, or CPM, is a neurological disorder that most frequently occurs after too rapid medical correction of sodium deficiency, hyponatremia. The molecules pulls water from brain cells through a mechanism that is only partly understood. The shift in water and brain molecules leads to the destruction of myelin. As we can see, the myelin are important to the concept of the stimulus, nerve stimulus. Okay, the nerve cells, the neurons, can also be damaged. Okay, certain areas on the brain are particularly susceptible to myelinolysis, especially the part of the brain stem called the pole. And some individuals will also damage in other area of the brain, which is called extrapontine myelinolysis, EPM. Applications in medicine. Okay, let's see this video. Okay, let's talk about the applications in medicine. The applications in medicine. The patients are rehabilitated of this disease and require extensive and prolonged neurorehabilitation. Um, the treatment is important to say that is supportive. The correction rate is controversial diligently about the hyponatremia. It is advised to study details concerning the etiology and correction of electrolyte disorders. The patients with alcoholism should receive a vitamin supplementation formally to evaluate their nutritional status. Okay. And some patients require language therapy, and some these professionals want us evaluate the physical speech and the area in the care of the patients. Oh, let's talk about the pros and cons. Some individuals die and some individuals recover completely. Although the disorder was originally considered to have a mortality rate of 50% or more, improved imaging techniques and early diagnostic to have led to better prognosis to many people. The most individuals improve gradually, but still configured to have challenge in speech, walking, and emotional ups and downs, and forgetfulness. Okay, this clinical which is important to some patients have the inability to move. Others make it the blink eyes. This is based in the lockhead and the syndrome, like we can see in the next video.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from
First aid for the USMLE. Page 419. Central pontine myelinolysis. What is central pontine myelinolysis? Central pontine myelinolysis is a condition in which there is acute paralysis, dysarthria, dysphagia, diplopia, and loss of consciousness. This is a condition that can cause locked-in syndrome, and in this there is massive axonal demyelination in the pontine white matter tract. What is the cause of central pontine myelinolysis? The cause of central pontine myelinolysis is iatrogenic, which means it's physician-induced, and this is caused by overly rapid correction of the sodium levels. So when you correct hyponatremia, you do it very fast, then central pontine myelinolysis can happen.
For more information on this topic, click on the link in the description section below for a full USMLE.
Okay, let's talk the issue applied in Ecuador. In Ecuador, it is rare entity. Its clinical manifestations continue to be a subject of study. The perception of this condition is one of high mortality, which is why there is not a specific treatment is only supportive, like I said previously, which is observed mainly in the adolescent chronic patients of chronic disease, accompanied of malnutrition and hydroelectrolytic imbalance. This is important. And we can see in the next video talk about more hyponatremia, but this is associated with CPN.
This is the schema that we're familiar with. These are our three categories of hyponatremia in relationship to ADH. So no urine output with normal water intake. People that make no urine, doesn't matter what their ADH activity is. Compulsive water drinking with maximal but inadequate urine output. These patients have ADH maximally suppressed. And then normal water intake with decreased urine output. These are the patients that are ADH dependent, and this is what we're going to be talking about today. So remember, ADH shifts water from being excreted into the toilet and retains it into the body. And in these patients, that reduction in urine output means that they have more water intake than water excretion, and it causes hyponatremia. There are two physiologic stimuli for ADH release: increased serum osmolality and decreased perfusion. First, let's look at increased serum osmolality. This really is irrelevant when it comes to hyponatremia because this happens when you have increased osmolality or hypernatremia. So we don't need to worry about this when we're dealing with hyponatremia. In this case, all we're worried about is decreased perfusion from volume depletion or from hypotension. And these are what we're going to be discussing in the rest of the chapter. Hyponatremia from volume depletion and hyponatremia from hypotension. Hyponatremia due to volume depletion. This volume depletion can be due to GI losses like diarrhea or vomiting, or renal losses like diuretics. The mechanism of action here is you get volume depletion, leads to release of ADH, decreases the urine output, leading to an imbalance with more water intake than water excretion. Hyponatremia due to hypotension. There are three causes here: heart failure, cirrhosis, and nephrotic syndrome, All of these cause decreased blood pressure or decreased perfusion. All of them are edematous states, and those are all represent hypervolemia. Again, the mechanism here is identical. Decreased perfusion leads to release of ADH, leads to decreased urine output, leading to an imbalance with more water intake than water excretion.
And finally, we have the conclusion. The central pontine myelinolysis is a succinct demyelination condition of the brainstem and recognized completion of inadequate treatment in patients with chronic hyponatremia, usually secondary to a rapid correction, is more than 8 mmol per day. Okay, the imaging findings evidence are MRI in association with clinical manifestations are the vital importance for the timely diagnostic of this pathology. So early imaging is recommended to confirm the diagnosis of the central pontine myelinosis. At the present, there are not effective therapeutic methods. The prevention of the appearance of the picture is in a vital importance since a few occasions a total is recovered is achieved. The basic injury consists of the destruction in the myelin sheaths with relative unharmed axons, and it is fed part of the whole base in the protuberance in symmetrical form. And this is the important the characters the pontine demyelinization. And thanks